Welcome to Health or Consequences, the Massachusetts Healthcare and Public Health Policy podcast on Commonwealth Beacon that runs under the Codcast label. I'm Paul Hattis of the Lown Institute, here with my colleague John McDonough of the T.H. Harvard School of Public Health. Now, normally I introduce our guest whom we plan to interview during our monthly episode, but today's a little bit different. This is because my co-host John has an important new health policy book coming out from Johns Hopkins Press next month on August 11th. The book is entitled America's Wrong Turn, U.S. Healthcare in the Neoliberal Era. As those of you listening today are getting ready for an August vacation where you often take a special book along, and I know many of you have health policy interests, this might be a consideration for you, and I want you to hear directly from John about his new book. But before I dive in with some questions for him, I want to say something about the structure of his book that I really appreciated. John, your introduction helps the reader get a real lay of the land of where you want to take them, both overall and in each chapter. And it really is a reference book of sorts for someone wanting to explore how a particular philosophy, in this case, neoliberalism, something I'm going to ask you to define in a moment, finds its expression in every aspect and component of our healthcare system. In each chapter, which takes a deeper dive into what you call the pillars of the neoliberal state, you back up what you say with well-researched and annotated references to key healthcare legislation, regulations, court decisions over the last 70 years, which have shaped the direction of U.S. healthcare policy. And especially for those of us who are younger than you and I, John, in our now Medicare age, who have not necessarily lived through all aspects of this era, those references and sequence, I think, is really important for the reader and much appreciated. And finally, in your last chapter, you share some of your own opinions and perspectives on what's happened over time with the U.S. healthcare policy system and some considerations for the future. So, John, congratulations really on a book that I really enjoyed reading. And maybe for starters, since the bulk of your book is about the challenges and pain brought to U.S. healthcare by the neoliberal era, please start by describing what that term is and who are and were its key intellectual and political leaders.
So thank you, Paul, for that great introduction, and thanks for agreeing to use this podcast today to talk about the issues that are at play in this book. I've been working on it for more than 5.5 years and think that it's quite important and significant and meaningful today. And I guess the primary hypothesis is there are a lot of issues out there that really are upsetting and distressing to consumers, patients, physicians, nurses, other providers. They come in all forms. There's incredible cost sharing. There's rising health insurance premiums. There's privatization of resources. There is private equity in the system, the financial mechanism that ruined Stewart Healthcare, among others. There's an immense amount of merger and consolidation. There are so many different things, and people are aware of these and think of them in some ways discreetly. And my point is that they actually all fit together. And there's an explanation for how the system has gotten to this very difficult position that we're in today that most people recognize. And the cause, from what I can see more than anything, is a political economic revolution that was global in its impact and particularly important in the United States, beginning in the late 1970s and then taking off like a rocket when Ronald Reagan became president in 1981. And the best definition I've heard for the word neoliberalism comes from a colleague at Harvard, Naomi Oreskes, who calls it free market fundamentalism. I mean, it's a belief in the free market, but a belief in the free market to perhaps an extreme extent, where everything that government does is suspect, should be repressed as much as possible so that the magic of the free market can work. And while there have been ups and downs and deviations along the way, for most of the 40-year period, the 4-decade period between 1980 and 2020, the rules of the road in terms of American economic policy largely conform to neoliberal principles. And so when I think of what is dissatisfying and frightening and alarming to people about our healthcare system, even though neoliberalism was not aimed at American healthcare, it turned out to have significant impact and changed our system in ways that have been significant in terms of the trouble that we're in today.
John, you mentioned a lot in the book, and practically all the chapters, Milton Friedman and his role in the Chicago schools. And we're saying a minute about that.
Yeah, so Milton Friedman is one of the most well-known, for many people celebrated, for other people quite not pleased with him. But he was one of the most significant economists in American history, particularly in the 1950s, 60s, 70s, and 80s. He got the Nobel Economics Prize in 1976. He had a major series on public broadcasting in 1980 called Free to Choose, which was really the best recitation of neoliberal principles in terms of how they shape not healthcare per se, but the overall economy. And he's very outspoken. He's recognized even by people like Paul Krugman, very much a progressive, as being a very skillful and respected technical economist. And he also was a polemicist. He had strong ideas. He got those ideas out there, and he made sure that people understood where he was coming from. And his ideas had dramatic shaping influence. And I'll mention some of them as we go along. There were many other people beyond Milton Friedman, Ronald Reagan, outside of the US, Margaret Thatcher, Gerhard Schroeder in Germany, Deng Xiaoping in China. All of those people in the 70s and 80s adopted the neoliberal playbook and advanced it around the globe. And today we're in a position where we have to look at the consequences and results. And I find, particularly as it pertains to US health and medical care, that the results have been destructive and harmful, and something that people need to understand to make sense of where we are right now.
John, let's dilate on that for a moment. As this neoliberal thinking ultimately had its impact in shaping the U.S. healthcare system, did it manifest through specific legislation, court decisions, presidential directives, agency rules, or was it more diffuse? How did we get to affect the healthcare system the way that it did?
It was absolutely all of the above. And much of what happened never was debated as a bill in Congress or a state legislature. This was done much more discreetly. The best example I can give deals with the dramatic changes in antitrust and monopoly legal authority that changed starting in the 70s and totally very much in the early 80s in 1981. So antitrust policy in the US started back in 1890 with the Sherman Antitrust Act. And the belief was that we have to prevent corporations from becoming too big by acquisition, merger, takeover, whatever, because that harms the competitive economy and it ends up then creating bad outcomes in terms of economic growth and other kinds of things. That's how it ran from 1890 really until 1980. And it was the neoliberal school out of the Chicago School of Economics, where Milton Friedman had his home, where Robert Bork, who was very much a neoliberal, later an unsuccessful candidate for the US Supreme Court, but he took on, for the neoliberal movement, he took on the cause of we need to change antitrust policy away from big is bad, we have to discourage big, to instead saying, hey, if you're big, let's celebrate you. You're big because you're successful. And as long as what you're doing will result in lower prices for consumers somewhere, then if you want to grow and expand through takeovers and acquisitions and mergers, green light, go ahead and do it. That's what the neoliberals and Bork advocated. Bork wrote it in a book in 1976 called The Antitrust Paradox. And in it, he outlined this agenda. And when Reagan came in 1981, he ordered the Federal Trade Commission and the Antitrust Division of the Department of Justice to rewrite the antitrust guidelines of the federal government that inform the activities of federal judges when they're sitting on monopoly and antitrust cases, that affect the behavior of federal prosecutors in terms of what they go after and how they go after it. And they rewrote the federal guidelines to conform with Robert Bork's premise of big isn't bad, we should let it happen, there's no big problem because the free market will fix it all. And so what we've seen over 40 years through this change in the federal guidelines, I mean, it was covered in the media, but very slightly. There was no public conflict. There were no arguments or disagreements to hear about the pros or cons. It was all just a very quiet exercise that was a fundamental change in how the federal government dealt with antitrust. And it has resulted in the past 40 years, and it's a 45 now, for the biggest wave of consolidation that we've ever seen in American history. This is even bigger than what we saw in the Gilded Age. And in particular, it has been, many people believe, growing numbers of people believe, the most consequential explanation for why healthcare in the United States costs so much. The extraordinary amount of concentration that we've seen in the hospital sector, where over 90% of hospital markets across the United States are mostly or heavily concentrated. In health insurance markets, where across the nation, more than 75% of health insurance markets are mostly or heavily concentrated, and ditto with physician marketplaces, with physician practices now over 60% are mostly or heavily concentrated. That didn't happen by accident. I'd say that healthcare was not the major intentional target, but you can't get into changing the antitrust rules for the overall economy and think, oh, we didn't mean medical care, because medical care got pulled into it. And again, lots of folks believe now, some really smart economists, thoughtful economists say, basically, if you want to understand America's healthcare affordability crisis, it begins with antitrust.
John, thanks for that discussion about consolidation, which we know has been a significant issue in our state, like you mentioned, across the country. But there's also been a financialization of assets, including healthcare assets, including through the efforts of private equity. And we've also experienced that in our state big time. And in some ways, it's the most purest expression of financialization, where private equity has bought up hospitals. We saw what happened with Stewart in our state. They've been buying up physician practices, emergency staffing groups, nursing homes, wheelchair manufacturers, etc. How central is this private equity evolution to the story that you're telling? And is it just a latter stage symptom of the neoliberal shift, or did it change the game in its own unique way?
Well, let me try. It's a great question, Paul. Thank you. Let me try to give the breadcrumb trail from then to now and how it got here. And it starts with, actually, it goes back to 1970. And the Sunday New York Times on September 13th, the Sunday New York Times Magazine had an op-ed column written by Milton Friedman. And the headline of the article was something to the effect of a Friedman principle: the only purpose of the for-profit corporation is profits to shareholders. And he meant it. In the 1970s, there was arguments about what did the corporation exist for? Was it there to help workers, to help customers, to help communities, to help the environment? Or was it something else? And Friedman came out. He wasn't the first one with the idea, but he said it in a way that caught the magic of the moment. He said, listen, the only duty of the for-profit corporation, and he said, the only duty is make as much money as you can for the stockholders, shareholders, and nothing else. And by the way, we think of the CEO of the company as the boss, the person in charge. We all need to understand the boss is the shareholder of the corporation. The board of directors are the agent of the shareholders, and the CEO is the agent of the board and the shareholders. And it's the job of the CEO to get up every day and look in the mirror and say, what can I do today to earn more money for my shareholders? And then go back to bed, because that's it.
Did Friedman ever distinguish between for-profit ownership, let's say, of publicly traded companies from private equity ownership in his writings?
Yeah, private equity didn't exist.
Okay.
It really emerged. What Friedman set off was a movement in the United States called Maximizing Shareholder Value, or MSV. That became a phenomenon that took off again like a rocket in the 1970s, and it grew in the 1980s into a movement called the LBO movement, or leveraged buyouts. Some people may remember, if you're as old as we are, things like the RJR Nabisco takeover that led to the famous book Barbarians at the Gates in the early 1990s. That was the story of the classic LBO. And it became so controversial. Some of the leaders in it went to prison for all kinds of legal shenanigans and pilfering money. And LBOs went out and reemerged in the 1990s as private equity. And they went after it in the early years, not going after healthcare at all. In fact, the sense was healthcare was too difficult and too strange for private equity. But starting in the 1970s and then taking off, particularly after 2010, the private equity world recognized, boy, this healthcare field is really good. We can make a lot of money on this. And there's a key here thing to understand. In medical care in the United States and around the world, there's a principle. It's embedded in the Hippocratic Oath. And it says that the duty of the physician is to the patient. And that has to come first, second, and third. And the private equity world, inspired by Friedman and maximizing shareholder value, there's an equal value there that's of compelling importance, and that is that the shareholder is the most important. And so when you have private equity and medical care coming together, you're really putting together two irreconcilable values there. Which comes first, the patient or the shareholder? For private equity, it's all about the shareholder. That's the structure. That's why they exist. That's what they're there for. And so what we've seen is literally the invasion of every crack and crevice of the U.S. medical care system by private equity financing, whether it's hospitals or physician practices or dental groups or veterinarians or hospices or home health. You can't name these days a piece of the healthcare puzzle that has not been invaded to a significant extent by private equity. And it creates fundamental problems. For a long time, we didn't have good research on it. The last 5 years, people like Zuri Song from Harvard Medical School and other folks have written the story of the hard evidence. And the hard evidence is when private equity comes in, prices go up, providers get worked to the bone and get alienated, and profits go up, and services go down, and a lot of times they actually close. And we see hospitals, physician groups, other kinds of practices disappear as they get rolled up into larger private equity vehicles where they can maximize their value as much as they can for their shareholders. So it's really close to a menace. It's probably even more than a menace. And it comes straight from the mind of Milton Friedman on September 13th. By the way, just a little anecdote. I say, and I've said a lot of times to people, I think Milton Friedman's column in 1970 might have been the most influential and impactful op-ed in American history. And interesting, on September 13th, 2020, the New York Times ran a special section, a whole section, where they reprinted Friedman's original column, and they had about 25 Nobel Prize laureates, economists, political scientists, ethicists, political leaders make comments along the way, mostly about where they thought Friedman was dead wrong. But they recognizing it, the New York Times in the section said this was the column that changed the course of American capitalism. And it very much changed the course of American medical care and healthcare.
John, when you look at that course, and as you've just noted, over 40, 45 years with neoliberal philosophy taking hold and the concentration and the for-profitization, including private equity, you were in the room observing this going on. Sometimes you were in the legislative room here in Massachusetts in the 80s and 90s, and sometimes you were in Washington, D.C. in the Senate staff rooms helping to draft the ACA. Was there ever a path available, whether you were as a legislator or working with federal legislators, where they were recognizing the challenges that were being created by all of this, and a way out of the path that we were on, or was it we were just sort of stuck there as this ball was rolling forward?
Well, I'd just say I served in the U.S. Senate between 2008 and 2010 during the process of writing and passing the Affordable Care Act. And I was in more than hundreds of meetings, small, medium, large, public, private, governmental, out there in the world. And I can't recall a single time when the issue of private equity was enunciated in that process. It was before private equity was recognized as an impactful force on the healthcare system. And so this came later. And it really started in the first decade, but it really took off in the second decade. And people didn't really start to notice and pay attention really until about 2015 in terms of what was happening in terms of healthcare. And now massive numbers of people are aware of this. But it's just a reality that it takes time for government to catch up and to be able to get their sense of what's going on, to develop some consensus of, is this even a problem or not? In the early days, lots of people say, hey, the problem, a lot of people say, and many people will still say it, the problem with healthcare is we don't have enough free market forces in it. And so anything that adds market-based pressure for it is by definition good. There are still lots of people who believe it. I think the evidence is astoundingly on the other side at this point in time in our history.
Now, John, your book marks how, in some ways, the neoliberal era possibly was over with the election of Joe Biden in 2020, and then you say with the re-election of Donald Trump in 2024, there's a little bit more of a question mark as to whether we've ended that era or we're still continuing it or we're into a new era or not. So, if we were both sitting here as my final question, 10 years from now, that would be a miracle in itself, of course. What's the one thing you'd point to as evidence that our country has actually turned away from a healthcare system shaped by neoliberal views and invested with sort of this profit maximization ethic? Would it need to look like a Canadian system or even a National Health Service, like England, to say that a turn has been made? Or could we have a Swiss-like private market system model operating in the U.S.? What would a critical policy thinker likely 10 years from now say, yes, in fact, we have or we haven't escaped a neoliberal shaping of our healthcare system?
Well, so a lot of people in the United States these days, I'm not sure how strong it is, but a lot of people say they believe in Medicare for all as a solution. And comparing that versus what we have right now, It's easy to say, I think that would be much better, but it's so massively complicated to get from here to there, and there's so many risks. So while that's clearly one option that would move us that way, there's lots of other things that we need to do as well that I lay out in the final chapter of my book. I think we need to ban private equity from any medical care that is patient-facing. If they want to be involved in financing new drugs and medical devices and things like that, that's fine. But I think we've got to remove them. I think we need to incredibly strengthen and bolster the federal government's incentive to go after unhelpful monopoly and concentration in a very serious way. I think we need a new patient bill of rights in the United States that really elevates patients in a much more effective way than what we see today. So I have a lot of steps like that. I think that we need to recognize, for example, how important organized labor is to an effective medical care system. They are probably one of the best assets a smart, enlightened management would have to be able to have a good relationship with their workers in that way. So lots of different pieces and things that can be done. The thing that I would just say is, and this is a big part of the book that we didn't have time to get to, but there's a Yale political scientist by the name of Stephen Skowronek who presents something that he calls a regime theory of American history. You know, most of the time we think of political eras, we think of an individual president, like the Obama era or the W. Bush era or whatever. And Skowronek says you've got to look at it as multi-decade eras that are governed by a common set of political economic ideas that then frame what some people call the Overton window of what is acceptable in that given era. And so in the book, what I contrast the Franklin Delano Roosevelt New Deal era, which started in 1933, and believe it or not, went all the way up to 1980. So that was 48 years. And then I look at the neoliberal era that started with Ronald Reagan, and I present, I think, pretty compelling evidence. That era didn't die when Reagan left office. That continued really until 2020. Joe Biden came in 2021. He really turned things upside down in a way that I don't think many Americans appreciate. And one of the best examples is what he did around antitrust. He totally threw out the Reagan antitrust playbook, brought in some amazing people, including this woman, Lena Khan, who became the head of the Federal Trade Commission, probably one of the best known celebrities in the Biden administration executive branch. She really showed that we could, in fact, turn this ship in the other direction. And it's a shame she only had 4 years because she had so much going on. And now we're stepping back. But there are other ways that Donald Trump in this term are violating many of the core precepts of neoliberalism, just to mention a few. Neoliberals actually are big believers in immigration. And Donald Trump is probably the worst enemy of immigration, legal or illegal, that we've seen. Donald Trump believes in government investing in the economy, taking ownership of AI and other tech companies. That's an idea that is just anathema to neoliberals. Another example is tariffs. Neoliberals hate tariffs. It's just another form of taxation. And they believe that they should be run out of town on a rail. And Donald Trump says tariffs is one of his favorite words in the English language. So with Biden to Trump too, we're in a confusing era. And it's not necessarily apparent right away what the new era is that you're in. And it will take a good number of years, I think, for us to really get the sense, particularly when we get past January 2029, when we'll have a new president coming in of one party or another.
John McDonough, enjoyed chatting with you about your new book coming out in August from Johns Hopkins Press called America's Wrong Turn, U.S. Healthcare in the Neoliberal Era. And I've learned, John, that you could actually go online and under a special code that if you put into your order HTWN, you could even get a 30% discount on your book and pre-order it before August 11th. John, thank you so much. I think our readers will really look forward to reading what you have just published.
Thanks for putting the time into this, Paul. Thanks very much. Appreciate it.
My pleasure.